A very warm welcome to all my viewers, to Sentinel's Newsmakers, and welcome to Mr. Mukul Sangma. He is the former Chief Minister of Meghalaya and now the leader of opposition in the Meghalaya Assembly. Thank you so much, Mr. Sangma, for joining me this afternoon on Newsmakers.
Yeah, good afternoon, and thank you for having me here. It's a pleasure.
Thank you so much, sir. Sir, let me start by asking you, you've been the former Chief Minister of the state. What are your thoughts, your comments on the Conrad Sangma government's handling of the COVID situation?
Yeah, handling of the challenges associated with the pandemic. As a state in this nation with such a huge population, I think every state has a share of burden of dealing with this pandemic. Now, in the first instance, I think what is important for us is to look at how the government has adopted the approach to deal with this outbreak of COVID-19. Now, you will probably like to refer to the fact that Government of India decided that it should be a notified disaster. Right. So once it's a notified disaster, the manner and approach with which we deal with this pandemic obviously can be seen as to what are those kind of the overall format that's available with any government of the day with such a disaster. Now, when we talk about disaster pertaining to natural calamity, okay, if there is a forecast of a cyclone, then we know how to deal with, how to alert the people who are likely to be affected. And we also know the likely areas which will be affected. But here we are dealing with a pandemic due to a very highly infectious disease. Therefore, it's a completely a different ball game. And therefore, how we deal with these should be based on the knowledge that's available before us, and also aggregate it with the knowledge that we have over a period of time, assumed upon ourselves to somehow aggregate them and put them in place. Now, I would not say that it is a challenge confined to one particular state, because the way we deal with this pandemic obviously is linked to the measures put in place in the first instance to prevent the virus from entering the country. Therefore, whether there was the measures which were required to be put in place, effective measures to put in place to somehow ensure that we, as far as possible, prevent the virus from entering the nation and thereby infiltrate into different parts of the country. I think that is where we've had a mistake in the initial stage itself. Therefore, today, having seen what has happened after the lockdown, and as we move forward with easing of the lockdown measures, I think we can easily understand whether the measures which would have been better for us would have been the measure to prevent the entry or prevention, rather than actually assuming upon ourselves I must say, the burden of actually mitigation of this pandemic.
Mr. Sangma, when you say that maybe somewhere the government faltered, so are you trying to say that the lockdown that was announced in the later part of March should have actually come in earlier?
Obviously, you see, when we are talking about dealing with pandemic being notified as disaster, then we need to look at whether we are prepared to deal with that kind of disaster. Are we capable of dealing with a pandemic in the event of the number of cases which will ultimately unfold before us, like what we are seeing now? The peaking is still taking place. It hasn't flattened. Therefore, we can assume and presume by the behavior of the the disease itself, because there are of clinical surprises. Therefore, assuming and presuming that we are only seeing for the possible peaking in the days to come, then you can also compare it with our capability to deal with the number of diseases which would be probably reported in every part of the country, whether you have the enough wherewithal in the existing healthcare system, you have enough beds, you have enough people in the medical fraternity. I think those are a few important things which should have actually provoked us to about other measures, rather, in other words, prevention, than rather mitigating something which is beyond our coping capacity.
Now that the relaxations are being announced, we are already witnessing unlock 1. Do you think that the lockdown should have been extended a little further?
See, I must tell you one thing that somehow or other, though we looked at dealing with this outbreak as a disaster, we did not actually look at how to fight against disaster and the available modalities that is already available with the government, both the state government and union government. We have the disaster management plan at the national level. We have the disaster management plan at the state level. Now, when we talk about dealing with a disaster, what is expected? We need to ensure that we actually ramp up the coping capacities of the community itself. We have seen how we prepare the community to actually prepare themselves to face any eventuality of any calamity. You have the mock drill, even in the hotels, you have the false alarm system to see whether you, in the event of any accident or fire, the whole people who are in the hotel, the staff, and also the inmates are capable of responding to a likely disaster. So that mock drill, all these things are important. Why do we do mock drill? Mock drill we do because we want to involve everybody and to see whether we are prepared. Now, that obviously require, when we are talking about this pandemic as a disaster, then we need to reach out to the community and then prepare the community. Okay, we are likely to be affected by this pandemic. So what are the things that is required to be done? So that is the format which is available in a disaster management plan. Now, have we been able to look at those available knowledge that is in the whole disaster management plan or not? Or we are trying to do something looking at new measures? So that is where things have gone wrong.
Okay. So you think that these are where the governments, both the central as well as the state governments, have been lacking in putting through things properly, getting the community involved, and preparing them to handle the whole situation. So if you were in power, what would you have done? How would you have handled the whole situation?
You see, we must learn from experiences. Now, when you're talking about experiences in dealing with this kind of pandemic involving very highly infectious virus, then we need to know, okay, what are those experiences which is available before the global community? Do we need to look at the past experiences of similar kind of situation where pandemic struck the whole global community? And what was the mistakes and what were the lessons there? You don't have to start from, without having to revisit the past and aggregate our knowledge upon the knowledge which is already available based on those past experiences. Now, if we want to do new things without actually leveraging upon the knowledge which is an offshoot of the experience of the global community of the preceding decades, preceding centuries, then we are only likely to end up doing something new, and it will be more like an experimentation rather than doing based on experience. That is what I am trying to say. So the manner in which we approach itself should have been different.
So are you in a way saying that the government was, kind of caught napping, or they were really not prepared, and suddenly India and all the states, they just got hit by this entire thing? Because, of course, China, it was already happening. Maybe our governments were really not expecting that India would get hit in the manner the country has got hit now. Like, we've surpassed Spain and so many other countries with the kind of cases that we've been reporting every day.
You look at Sure. You look at, what was happening, what was the narrative across the globe in the month of January. Okay, what was the narrative? The narrative revolved around this infectious disease, COVID-19, and the likelihood of these particular disease becoming a pandemic. Now, Government of India eventually decided that we must notify this as a disaster. So that means Disaster Management Act 2005 was in operation. They invoked this powerful act. And also, the Epidemic Diseases Act 1897. Now, if we are looking at those acts, then Epidemic Diseases Act 1897, if you go back, revisit 1897, and what were those laws meant for? To empowering the authority to stop the ship who is likely to enter the country. So that means the prevention is not in Meghalaya. Prevention is not supposed to be something which is required to be done in Manipur, Meghalaya, or different states. It should be from the perspective of that knowledge which is already available, and it is also available in the law itself, which is one of the laws which has been invoked, 1897, that Epidemic Diseases Act. That's why there has been, I mean, I must be blunt, there's a reason for me to believe that maybe the government of the day was not advised properly, or may not have been advised by people who are having the expertise in their respective domain to deal with this kind of epidemic, pandemic, and infectious diseases. That is why what I look at. Or otherwise, even in spite of availability of this advice, maybe somebody decided not to take the advice. So either of the two.
Right. So, Mr. Sangma, coming back to Meghalaya now, of course, you've been very vocal about the whole migrants issue. You want the government to take every possible step to bring them back home. Now, that also raises a whole question about, we've seen how the numbers are rising after people have started coming back home. That is one. Is Meghalaya doing enough to accommodate and take care of the rising number of cases? Is the state really in a position to do whatever is necessary to take care of the people? Because it's not just the COVID cases. There are other patients too with maybe a heart disease or any other ailment. That too has become a cause of concern for most of the states at this point of time. And also the larger issue of livelihood opportunities for people who might have lost jobs outside and are now back in the state.
It's been quite a painful for every one of us to see what was unfolding after the lockdown was enforced. Yeah. And if you look at the kind of hardship to which the migrant workers have been subjected to, we can easily draw the inference that this group of people, and including the poorer section of the people who were not, because they were not migrants, they have borne the brunt of this pandemic and the associated measures put in place by the government disproportionately. And this is because the inequality in the whole socio-economic landscape across the country, though have been attempted to be addressed by successive governments in the past, we have not been able to really, reduce this gap between the haves and the have-nots. Therefore, the have-nots have borne the brunt of the pandemic disproportionately. And this is something which must be able to invoke a process of thinking amongst all of us, particularly the policymakers, and call for corrective measures, course correction, so that in the event of us, when we are talking about collectively fighting against this pandemic, that means everybody must be, enabled to have a level playing ground. And then only you can expect that, okay, everybody will have the coping capacity in our fight against this kind of war. It's a war against the virus. Now, if you are saying that, okay, we want to collectively fight, then it's important to ensure that everybody who is going to the war is equally effectively trained to be able to cope with the challenges. And this has whatever visuals have been available before us through various electronic medias and social media. I must tell you that it must be a wake-up call. It must be taken as a wake-up call for all of us to really address this issue of the huge gap and the likely widening gap between the haves and have-nots. That is what is crucial, and that is what is important. Then only in the years ahead, in the decades ahead, if we are confronted with these similar kind of challenges, which is very, very likely, we will be able to say that, okay, we are more prepared than before. And therefore, various interventions are required to ultimately, now it's a question of enabling to really recover from the shock. Is in shock. If they are brought into a medical emergency, we actually activate the whole medical staff to ensure the person is restored from the shock. Then we give treatment. So if you're looking at the situation now, the reality and the truth is that quite a substantial number of the population of this country are really a victim of these stress and shock, both social and economic shock. Therefore, restoration, number one. Therefore, number of interventions. It should not be seen as something which is a response to help them. It should be something seen as a response for course correction of our wrong approach of dealing with this disaster, resulting in creating such kind of victims. Now, they are the victims of this particular pandemic and also the measures put in place by the government.
Okay. So going forward, also the whole hospitality tourism sector has been badly hit. So what would be your mantra to revive these sectors?
You see, tourism sector cannot thrive or grow in silo. There will be various other measures put in place in the first instance to create that enabling environment for making a place an attractive destination for the tourist. Now, if you revisit the past, what I used to always share with our friends from media and also the policymakers in Delhi is that in respect of Northeast, when we talk about our states in, as individual states, we must look at the impact on the Northeast as a whole. When the perception about Northeast always is linked to issue of law and order, lawlessness. And if one instance of law and order problem is reported by national media, the perception generated affects the whole Northeast. Then there are lots of advisories given by the embassies of the respective nations that the citizens may avoid traveling into Northeast. I think this is what has happened. And this is also coincidentally something which has happened on the run-up for this pandemic. The Northeast, even before the rest of the country, was affected by various protests and agitation against the CAA. Therefore, people were not actually visiting Northeast. I think that must be one of the reasons why we had less footfall. And therefore, you are a witness to a situation which is different from the rest of the country, because whoever have turned positive in our test for identifying any infected person with COVID-19, so happened that only people who have returned from other parts of the country have been exposed to that kind of infected environment, and then therefore some of them have landed up contracting the virus, and therefore we have some positive cases. So the perception about this is very crucial. You are looking at clients who will visit from other parts of the country and other parts of the world. So why will people not prefer a place where they feel more secure? At the end of the day, people are not going to risk. And even if there are some adventurous people, there has been advisory by the government itself that, okay, you may avoid traveling. So what is important today for the Northeast and in particular for Meghalaya is we should ensure that the perception about the state is addressed in the first instance. We did it. You might recollect, the years preceding 2008, Meghalaya started becoming one of the emerging new destination for the global tourists. And at the same time, we saw, steady increase in the graph in respect of the visit of the tourists to this part of the country, particularly Meghalaya. But suddenly you have, sparred up, lawlessness, and then government not being able to address those, and then ultimately create a perception contrary to the positive perception to attract tourism. You cannot promote tourism.
Right. Mr. Sangma, you spoke about the interventions that is required at this point of time to address so many issues which we've just discussed, including the migrant workers issues. Also, the need to change the perception for a turnaround for the tourism and hospitality sector. So you all have been having interactions with the Conrad Sangma government. If I remember correctly, there have been a couple of all-party meetings that the Conrad Sangma government has held. So has talks on these lines happened? Have you maybe communicated with the present government that these are the things that needs to be done? Is there any thinking? Of course, now I know the priority right now is to take care of the COVID cases and other patients. Of course, that's topmost priority. But these also are things which have to, be taken into consideration maybe now than later.
Yes, obviously. See, what is very important for us to remember is that when we look at February and March, we realize that, something has gone wrong somewhere. Therefore, you're seeing cases, though the cases were limited at that point of time. But then we knew that the virus has entered the country. Then with this highly infectious virus, we actually could foresee as to what is going to happen eventually. And this is before us now. Therefore, we wanted the state, and we wanted to make the government of the day realize that there is an opportunity for state of Meghalaya and the rest of the northeastern states, since the number of positive cases in respect of COVID-19 till then were not there. Therefore, even before the virus enters this part of the country, should we not therefore put in measures so that we are able to take advantage of this situation and ensure that the state remains free from infection? Now, based on that, the discussion ultimately unfolded. We had a number of sessions, and we were able to share our whatever knowledge we have gathered from the available documents pertaining to the pandemic and the manner in which the global community responded to those kind of situations, and therefore how we can correlate to those measures which are considered effective, and also alert ourselves about the measures which were considered as ineffective. Therefore, look at how to converge our ideas and put them in place in the best interest of our people and the state. It happened. But what is missing today with the government is that I have suggested there must be transparency. Transparency to actually share information with the community, with the citizens. Unless that happens, it is going to be difficult. It is going to be difficult. Now, the information sharing and sensitizing the community in the first instance did not happen to the extent that was required. And we continue to do so. So government cannot be expected to only share the statistics. The politicians, the chief ministers should not behave like statistical officers. That is what is going wrong. Therefore, transparency, and ensuring that people know what's this all about. Why are the various activities, the normal activities of citizens are required, restricted to a great extent, and when it is time as appropriate for these restrictions to be eased out, then how the new normal should be. I think those are a few important conversation. Conversation means you're sharing your information, and therefore using in a two-way conversation. It cannot be just one way sharing of message, one way sharing of information. It has to be both ways, because you're talking about war.
Right. Okay. So, and also one more quick query before we close. This is regarding the what we have seen over the years. It's of course not just specific to Meghalaya. It's true of whole of Northeast India. Many of our students, many of our workers, many of our youth actually, they always leave their home state looking for much more lucrative job opportunities. Students leave for better education. Do you not think that this is now, now is the time to really look into all these aspects and maybe have better quality jobs and better quality educational institutes for our students and our youth, so that they do not have to go through the pain that they have to go through, not just because of COVID. There's also the other huge thing about racism that they face. Students from across Northeast, people from Northeast face whenever they're there in rest of India. So don't you think it's high time to focus on all of these things?
It is high time, and I must share with you, with utmost sincerity and honesty, that this thinking has been there for a long, long time. Successive government has actually had a conversation amongst the governments between the states and the union government. And Government of India has come up with a number of initiatives. You have the Pan-India program for higher education, the RUSA. Okay, then various other interventions. And this engagement continues. But at the same time, in respect of Northeast, we have to have beyond something which is considered as, okay, the normal approach. It is an extraordinary situation for the people of the Northeast. People who are looking for even a better education. Their parents are compelled to send their children outside the Northeast.
Yeah.
Parents who are trying to respond to the desire of the children to go for better higher education, they are compelled to send their children outside the Northeast. And that has always been the case, whether it is in respect of Assam or the other seven sisters of the Northeast. Therefore, it is an extraordinary situation for Northeast, whether it is in the field of medical health education, or it is in the relating to the institutions which provides you higher education in technology, in research and other activities. There is a need, therefore, for looking at this issue in respect of Northeast as a different agenda altogether. And that's the reason why Government of India must come with a separate assistance extended to enable these states of the Northeast to bridge this huge gap. And that was the reason why all the state governments of the Northeast have always tried to prevail upon Government of India to look at Northeastern region as the region which has bore the brunt of the partition. Thereby, somehow not having been able to keep the pace with the rest of the country in our march ahead to progress and prosperity, post-independence. Therefore, we must be seen as people of the country, as region of the country, who were handicapped due to our historical background. And therefore, it must be seen as a responsibility of the union government to actually take care of these disparities in respect of development, particularly in social sector. The moment it is done, I think everything else will fall in line. Somehow or other, though there has been a collective endeavor, I think Northeastern state at this juncture is not really articulating this issue more aggressively with Government of India. I would urge upon all the state governments of the Northeast to collectively voice this concern, articulate in a right perspective, and try to prevail upon Government of India. It should not be seen, as something which is a response to a begging for the state coming with begging bowl. I have always seen this tendency with people. Whenever we talk about this issue and the need to take care of the Northeast with a special package, it is more often interpreted as the states coming with a begging bowl. That's not correct. That should be corrected. That perception should be corrected. Because the Northeastern states, with its huge potentialities in its own backyard, must be empowered to really join the rest of the country in its march to progress and prosperity, and ensure that Northeastern states are capable of really contributing for the growth and prosperity of the state, of the nation as a whole.
Right, right. Of course, some other time we will also discuss the role of donor ministry, how effective and efficient has that ministry been for the entire Northeast. But before I let you go, since the Rajya Sabha elections are just few days away, 19th is when the elections happen, there is this Congress candidate, Mr. Kennedy. How are the numbers looking like? Is he in for the upper house?
Elections are elections. And until the last vote is polled, all the political parties, they do have their own strategy. And in as far as these strategies are concerned, I think we try to put the card as close as possible. We actually like to say that, okay, we are looking at all the possibilities, but we are keeping the card close to our chest.
All right. There's a lot I would love to talk to you about the future of Congress and more about your plans for Northeast and your constituency. But maybe some other time, definitely some other time, we will have a longer conversation. Wonderful speaking to you. Thank you so much for your time. Thank you, Mr. Sangma, for joining me on Newsmakers today. Thank you
It's
so
a
much.
pleasure. It's a pleasure. Thank you. And
Thank you.
to all my friends who will be watching this conversation, we must be prepared to look at the new normal, and we must actually convince everybody to look at doing things differently in the days ahead.
Thank you so much. Bye. And thank you, viewers, for watching.